My name is Carol Bradley and I live in Menlo Park. I lost my husband Mike due to medical negligence. That's when I learned about a law passed by politicians in 1975 that limits the rights of families like mine. Mike had fairly good health. He was 72 years old and still working full-time. His cardiac situation got to the point where his valve was not functioning 100%. It would be better to repair the valve now when he was relatively healthy. I have a 51-year career as a nurse, and so I can remember when they were unable to do this surgery at all, and now it's fairly routine. And I heard them call what they called a stroke code and identified his room number, and my heart went down to my feet, and they told me that he was having seizures. There was something that occurred out of the ordinary during the procedure. It had been weeks that he was in the hospital and he was slowly recovering, and received a call around 5 in the morning to tell me what had happened. The feeding tube never should have been pinned to his gown, and it's against the hospital's policy and procedure to do that. Apparently he just in his sleep removed the gown, and the nurse having pinned it to the gown, it just pulled it and out of the stomach. I actually interviewed a total of 9 lawyers, and each one I was unable to retain any of them. Their efforts would far outweigh the amount of money that they would make. A life is a life regardless of what the age is. I think that the cap needs to be raised so the hospital is aware that they have to try harder to prevent issues from occurring.